All right. All right. Well, again, welcome to the Overcoming Hyperthyroidism chat. Thanks for joining me on this Saturday. And I hope everyone's having a good weekend so far. All right. So let's, I think when I set up Zoom, I think I accidentally clicked where videos don't show. So I think you could show your video. You just have to click on it. But I think the default was for not, usually when I do Zoom calls, we could see everybody. And yeah, anyway, so so if you want to show your video, feel free to do so. If not, no worries. And it looks like we're, just double check. Yeah, it looks like we're good to go on YouTube as well. All right, so I am going to give a brief presentation, probably like 10-15 minutes. And really the main purpose is to answer questions related to hyperthyroidism. And all right, it looks like we have a few questions. I mean, feel free if you want to type in your questions. I'm not going to get to them right this second. All right, and a private message. Hello, Dr. E. How have you been? I have been doing great. Hope you've been doing well. Thanks for showing up. We got a good crowd here. And so let's first, before I dive into the presentation, I'm going to discuss, take a minute to discuss some announcements, really one announcement. So be on the lookout for a free 5-day hyperthyroid healing diet challenge. So it's not available yet as far as registration goes, but it'll be starting 2 weeks from this Monday, which is February 1st, again, completely free. I did something similar in August, even though it wasn't specific to hyperthyroidism. So the way it's going to work, again, if you are part of the August challenge, this one is going to be very similar. So you will receive a daily pre-recorded lesson that's approximately 10 to 20 minutes long, as well as an assignment. There will be live calls on Facebook and Zoom. So here we're doing Zoom to YouTube, but I'm creating a new Facebook group. You don't have to be a participant in the Facebook group you don't have to join the Facebook group to be a participant in the challenge, but a lot of engagement will be taking place in there. So there'll be a new Facebook group. So I'm going to have it on Zoom, but I'm going to be streaming into the Facebook group. I will be rotating the times of the live calls to accommodate those in different time zones. So again, every day the lesson will be pre-recorded, so it doesn't make a difference where you live, but then I'll have live calls kind of like this. It'll focus on a specific topic. So registration details coming soon, probably in about a week. And again, I'll be creating a new Facebook group, as I mentioned. So I have what I did in the summer when I had the 5-day challenge in August. I created what now is the Graves and Hashimoto's Facebook group, and that's almost a little over 2,900 members, so closing in on the 3,000 mark. And so, yeah, I'm doing the same here, but just making it specific to hyperthyroidism. And all right, let's see. We have again something. Yeah, feel free to type in your questions, and I'll try to get to. I can't promise I will get to all questions, but I will try my best. I will definitely have at least one more of these before the challenge. I'm not sure if I'll have one next week, but almost definitely like the weekend before. And again, there'll be opportunity during the challenge, to answer questions too. So during the Zoom call. So make sure you sign up for that. All right. So what I decided to do, coming up with a topic today, I'm just going to really talk more general about hyperthyroidism today, just like the 4 different types of hyperthyroid conditions. Graves' disease is the main one, but then there's also toxic multinodular goiter, subacute thyroiditis, as well as Hashimoto's, which really is Hashimoto's presenting as hyperthyroidism. And it's worth mentioning that many people with Graves also have antibodies to Hashimoto's. All right, so we're going to briefly cover each one of these. So as far as causes of Graves' disease, You might have heard me talk about the triad of autoimmunity, which includes a genetic predisposition, one or more environmental triggers, as well as an increase in intestinal permeability, which is leaky gut. So in order to develop not only Graves' disease, but other autoimmune conditions, according to this theory, you need all three of these. And of course, you can't do anything about the genetic predisposition, but the good news is that you can get into remission by addressing the triggers as well as healing the gut. And there's 4 main categories of triggers. I'm not saying there's only 4 categories, that this is like all inclusive, but 4 main categories. So category number 1, food, such as gluten, dairy, corn, stress. Number 3, chemicals, such as heavy metals, BPA, xenoestrogens. And then category number 4, infections, such as H. pylori, Epstein-Barr, Lyme disease. All right, and then there's toxic multinodular goiter. So toxic multinodular goiter, so multinodular goiter is the most common of all the disorders of the thyroid gland. So most hyperthyroidism is caused by Graves, but multinodular goiter is actually the most common disorder. And this involves a goiter swelling of the thyroid gland in the presence of multiple thyroid nodules. So toxic multinodular goiter involves multinodular goiter in the presence of hyperthyroidism. And as far as the causes of toxic multinodular goiter, estrogen dominance, problems with estrogen metabolism. And there's a test called the Dutch test, which is a dried urine test that looks at estrogen metabolism. Not something I recommend to everybody, but sometimes I do recommend that to patients. Also, this little bit advanced, but maybe for some of you it's not, but supporting what's called methylation, sulfation, like eating plenty of sulfur-based foods, glutathione, which is the master antioxidant that helps to support detoxification pathways. Insulin resistance is another potential cause of toxic multinodular goiter. So you definitely want to address blood sugar imbalances, but also inflammation is important. There's with insulin resistance, typically an inflammatory component. And then the controversial iodines. I'm not going to get into detail with iodine. Iodine can also, in some cases, worsen toxic multinodular goiter, but in some cases, it could be also due to a deficiency. All right, so subacute thyroiditis. What causes subacute thyroiditis? So first of all, there are 2 main types of subacute thyroiditis: subacute granulomatous thyroiditis, known as Descartes-Vane's thyroiditis, and is very painful, and then subacute lymphocytic thyroiditis. So this typically doesn't involve any pain, and oftentimes it's mistaken for Graves' disease, which is why you definitely want to test antibodies, but sometimes endocrinologists will just look at the presentation, the thyroid panel, and conclude it's Graves'. So both of these conditions are, or at least in the literature, it shows caused by viral infection of the thyroid gland. And this causes inflammation, and this damages the thyroid follicles, and this causes thyroid hormone to be released into the bloodstream, and this results in the symptoms of hyperthyroidism. And the hyperthyroidism usually lasts anywhere from a few weeks to a few months, and it's usually followed by a period of hypothyroidism, like the last 6 months or longer, and in some cases be permanent. Most of the time, it's actually less than 6 months, many times like 2 to 4 months, but it could last longer than that. And viruses that have been associated with subacute thyroiditis. So we got measles, the viruses associated with measles, mumps, influenza, enterovirus. We got Epstein-Barr, adenovirus, echovirus, St. Louis encephalitis. So rubella associated with German measles can also be a potential trigger of, again, subacute thyroiditis. And this is an article showing that, or in PubMed, a published article. And then also coronavirus. So our newer virus can cause subacute thyroiditis. And I released an article. If you visit my website, naturalendocrinesolutions.com, this, I think it was in September. I was just doing updated research just to see if there was anything showing a relationship between COVID and thyroid health. And there were some studies, and at least one, I think multiple studies, not just one, but a few studies showed that that COVID can cause subacute thyroiditis. So, and I pretty sure I've come across one, not a patient, but I did a challenge, a 21-day challenge in November, and one of the people who joined, she had subacute thyroiditis and also had COVID. So, all right, so 3 ways to differentiate Graves' disease from subacute thyroiditis: an elevation of TSH receptor antibodies. The most specific TSH receptor antibody for Graves is thyroid stimulating immunoglobulins. Also, signs and symptoms of thyroid eye disease, which are associated with Graves. And then also, endocrinologists like to do the radioactive iodine uptake test. I'm not a big fan of that. I mean, if you had the test, I wouldn't stress out about it. But if they're recommending it, I mean, to me, it's definitely not necessary in most cases to diagnose Graves. If someone has the TSH receptor antibodies, the TSI, that's elevated, then that's pretty much diagnostic. They'll say for nodules and to see if you have like hot or cold nodules, but yeah, which again, if you have a cold nodule, greater chance of it being cancerous, but still, I think 95% chance it's not cancerous, that it's a 95% chance it's benign. So I usually just recommend an ultrasound rather than doing the uptake test. Okay, and then hashitoxicosis. So how is hashitoxicosis diagnosed? Depressed thyroid stimulating hormone. So that's, of course, the same with Graves or really any of these conditions, depressed TSH, elevated T3, T4. But then you'll have elevated thyroid peroxidase and or thyroglobulin antibodies and normal thyroid stimulating immunoglobulin. So a number of people attending here you might have antibodies to all 3, or maybe 2 out of 3, maybe TSI and TPO, but some people wouldn't be a shocker if a good chance, at least a few of you have all 3 antibodies. So that doesn't mean you have hashitoxicosis. If you have hyperthyroidism with the TSI positive, then that's, again, diagnostic of Graves' disease. But if you have negative, normal thyroid stimulating immunoglobulins in the presence of hyperthyroidism and elevated TPO antibodies and or thyroglobulin antibodies, then it very well might be hashitoxicosis. And this, especially if you developed it after giving birth, that's typically postpartum thyroiditis. So some people will be told they develop Graves' disease, and I'm not saying that can't be the case, but sometimes they actually have, many times it's hashitoxicosis. All right, and then also negative radioactive iodine uptake test in most cases. All right, so yeah, so I went like 10 minutes. That wasn't too bad. So let's go ahead and open up for questions. And just if anybody trickled in late, what I'm going to do is I'm going to just bring up the challenge that's coming up. Again, registration is not available at this time, but it will be within a week. And that free challenge will be starting 2 weeks from Monday, February 1st. And yeah, during the August one, we had almost 1,500 people register. Now that was general. It was accelerated thyroid healing was the name of the challenge. So I don't expect that many people. I would expect probably a few hundred people would be my guess for this challenge. But we'll see. We'll see how many people actually register. And so again, type in, I know we already have people typing in questions. So feel free to type in questions for those on Zoom and for those on YouTube. Also, we have a few questions on YouTube. So yeah, definitely type in your questions on YouTube as well. And I will just pretty much go back and forth. I'll spend more time on Zoom probably just because there's more people and more questions, but we'll just kind of play it by ear. All right, so Kate here, she asks, can I ask if you believe there's any link between hyperthyroidism and autonomic dysfunction? So I'm not sure if you have anything specific, like specific conditions in mind, or if you're just talking about, can it, affect vagus nerve or, imbalances, again, parasympathetic, sympathetics. I mean, thyroid hormone, I will say, it's probably more the opposite, like stress affects, autonomic nervous system. Stress affects a lot of things. And again, stress could potentially be a factor with hyperthyroidism. But of course, thyroid hormone affects pretty much every cell tissue in the body. So yeah, I can't say there's no link, but again, if you want to get more specific with that, definitely feel free to enter that in the chat. And then Audrey here asks, is it possible to be cured of hyperthyroidism? If so, are their blood tests sufficient to determine that? Or are the blood tests sufficient to determine that? So with hyperthyroidism, I don't like to use the word cure, so I will say that. I did early on. I've been in remission since 2009 from Graves. I feel like I've been cured. I feel like I'm cured. I had a few scares, like when I was diagnosed with chronic Lyme in 2018. I was worried that I might relapse, but thankfully I didn't. But again, there's that genetic predisposition that I mentioned earlier. So I like to use the word remission and talk about permanent remission. That there's always a chance, even myself. I mean, I could relapse. You never know. But so the way I like to think about it, we could get most people to the point where if they were to walk into an endocrinologist's office, that they wouldn't be diagnosed with hyperthyroidism. And is that a cure? I mean, it depends on the person's perspective, but like I said, I don't like to use the word cure. And then as far as are blood tests sufficient to determine that? I mean, if someone has Graves' disease and, so if someone has depressed TSH, elevated thyroid hormone levels, and let's say elevated, positive TSI, thyroid stimulating immunoglobulins, and if all those are normal, then I would say that, I would say that typically is sufficient. That being said, of course, there could be other, like when I was dealing with Graves, I also had problems with adrenals. And, when even when my numbers look good, eventually I did retest the adrenals because I wanted make sure the cause of the problem was addressed as well, I guess is my point. So blood test, I mean, they might be sufficient, but usually they're not going to be sufficient to identify all the triggers and underlying imbalances. And that doesn't mean someone has to spend thousands of dollars worth of testing. But I always recommend more than just like a thyroid panel and antibodies. So I'll recommend other tests, blood tests like vitamin D, and just even basics like a complete blood count with differential and comprehensive metabolic panel. Usually recommend adrenal testing, not in the blood, usually saliva or dried urine testing. And, it depends on the person. Sometimes I will do more comprehensive testing. All right, so we got Luke from Canada. All right, so yeah, I probably should, I need to get in the habit, like when I start these things, to ask people to type in where they're from. So sometimes I do that, sometimes I don't. So being that it's a day call, I'm guessing we might have some people from Europe here. But so Luke says, Dr. O, I'm 33. I've been on methimazole for 10 years. Wow, that's a long time. I've usually been on a fairly low dose, 2.5 to 10 milligrams. So 2 years ago, I had great success with the AIP diet. But just as I was about to stop taking methimazole, I started experiencing horrible digestive issues, and my Graves reactivated with a vengeance. A year and a half later, a gastroscopy revealed an aphthous ulcer in my small intestine and lymphocytic colitis. I reacted adversely to probiotics and glutamine, even at low doses. Colitis is chronic, and anytime it flares, Graves does too. How can I heal my gut if the two most common healers make things worse? I'm still mostly AIP with exception of rice and avoiding FODMAPs. So, I mean, probiotics and glutamine, so I assume that's what you mean when you said two of the most common healers make things worse. So I do commonly recommend probiotics and I like glutamine, but I wouldn't say they're absolutely necessary to take in order to heal your gut. I mean, when it comes to gut healing, one of the main things you want to do is remove the factor that's causing the inflammation in the gut, that's causing a leaky gut. And yeah, probiotics can help, just re-inoculating. I talk about the 5R protocol at times. So the first R is remove, again, removing the factor that's causing the gut problem. And then the second R is replace, things like digestive enzymes and, stomach acid. And then number three, the third R would be re-inoculate, so things like probiotics. And you could also try to do that through fermented foods. But if someone has SIBO, you said you're avoiding FODMAPs, so some people might have to address that prior to taking probiotics or even eating fermented food. Fourth R is repair. That's where L-glutamine falls. But you don't have to take L-glutamine to repair the gut. It may help to speed up the process. Same thing with like drinking for those who are, if you're not a vegan vegetarian, there's bone broth, but I wouldn't say that's absolutely necessary as well to heal the gut. And fifth is rebalance. So someone mentioned like autonomic nervous system. So number 5, like balancing parasympathetic nervous system, and you're just doing things, making sure you're managing stress and getting enough sleep, which is a problem with a lot of people. What was I going to say here? So yeah, so I would focus more on, you're following, still, you said mostly AIP with the exception of rice. So you're eating clean. But I mentioned earlier how food is one potential trigger, but there could be other factors. I mentioned the stress. I mentioned potentially, hidden infection. Well, I didn't say hidden infections, but sometimes they are hidden. When I was dealing with chronic Lyme, who knows how long I had that in my body before developing symptoms yet. Again, if you asked me before I developed it or before it was diagnosed, if I would, I would never have thought I would be diagnosed with Lyme. So again, focus. It's great that you're doing a lot with the diet, and again, the challenge is focusing on diet. I don't know how much you'll benefit from it, but I still would say it's hands. And then on the 5th day, actually, we're talking about things other than diet. So it's a hyperthyroid healing diet is the challenge. We're talking about other things as well, and so that's what I would say. It's colitis. Colitis, different types. I've dealt with like ulcerative colitis, and that also could be challenging as well. But diet plays a big role. But again, there could be other factors as well. All right. So you remember the essential oils that could help with reducing the goiter. I'm still dealing with the off and on swelling. Is that a sign of thyroid flare-up? All right, and thanks for your questions. Stay in your lane. Hope you're doing well. So typically, myrrh and frankincense, and I've written articles. If you visit my website, and just if you type in just essential oil, so if you visit naturalendocrinesolutions.com, there's a search bar. Type in essential oils, and then there's a few different articles. One gives like 5 different essential oils that could help with thyroid health, and myrrh and frankincense are among those. But then I have a separate article that just talks about myrrh and frankincense. And you always want to dilute essential oils. You want to be careful. But again, read the articles. Definitely check out the articles. And then I know there's a few different books on essential oils. There's one from Dr. Eric Zelensky, which is really good if someone's new to essential oils and they need more direction as far as like dosing and usage. And of course, you could find, I'm sure, plenty of information on YouTube, and just doing some searching too. You just got to be careful with the source. All right, so this is a private message, which means that you won't be able to, nobody else will be able to see it, but I'll read it out loud, even though it might have not been an intentional private message just because the person's name isn't even revealed. But anyway, I'll just read the message here. So I have an enlarged thyroid with benign nodules, no longer have hyperthyroidism or any autoimmune disease. Is there a natural way to shrink the nodules in the thyroid? So yeah, that's it sounds like multinodular goiter, which I mentioned earlier was, like the most common thyroid disorder. And a lot of times multinodular goiter, the person is euthyroid, meaning that the thyroid hormone levels are looking good. Sometimes the TSH is out of range, or at least outside of the optimal range. So I mentioned earlier problems with estrogen metabolism, as well as insulin resistance, blood sugar imbalances. Those are probably the two big things I'd focus on. I also mentioned iodine deficiency too, but typically in my practice, I'll focus first on estrogen metabolism, as well as making sure the person doesn't have problems with insulin resistance. All right, so Kate said, one of the main reasons I believe the autonomic nervous system is directly linked to my flares is because my most recent flare was after I had COVID. Yeah, I'm sorry that you dealt with COVID, but yeah, and maybe, I mean, it could be, like I said, stress definitely will affect autonomic nervous system. So I think your question before, though, is if hyperthyroidism will affect autonomic nervous system, which, like I said, maybe, I'm sure it could, but the opposite, as far as autonomic nervous system dysregulation affecting thyroid and immune system, thyroid being affected with hyperthyroidism, that definitely could be a factor. All right, so let's see. So, doctor, tell me what is the best food? I don't understand your question. It said, tell me what is the best food, and then you said thyroid highest. So I'm not sure if you're asking what food is. Yeah, I mean, I'm guessing you're not asking the food that has the most thyroid hormone, because you don't get thyroid hormone from food. As far as like supporting, I mean, I would just say, and again, I mean, not focus, but attend. If you have food questions, I mean, you could ask them here, but definitely when it's available, sign up for the challenge I'll be having, the free 5-day hyperthyroid healing diet challenge. And yeah, so I mean, just in summary, just very quick, just whole healthy foods, of course, you want to focus. I wouldn't say there's like, one or two specific foods. I mean, I do have articles on like power foods, but again, really whole healthy foods, good amount of vegetables. Some will say not to eat goitrogens, which actually, now that I mentioned that, I forgot if I brought that up with the hyperthyroid challenge, even though that's more, I need to put that in my notes here to make sure I cover that somehow, either if not during the lessons, during the live calls. Because I was going to say, you might hear about goitrogens, which are typically more, people tell those with hypothyroidism, Hashimoto's, avoid goitrogens because they can inhibit thyroid activity. But honestly, I've tried using them in some people with hyperthyroidism, and they don't really work well. So yeah, I would definitely say most people eat cruciferous vegetables, avocados, which, is a fruit. So, minimal fruit, but avocado's a little bit of an exception. But yeah, anyway, definitely attend the hyperthyroid healing diet challenge. So Joan, and also you could find out, if you don't want to wait until then too, you could find out some information on my website. I have hundreds of articles, blog posts on there. And some of those do talk about diet as well. So Joan says, I am taking 10 milligrams of methimazole for hypothyroidism as a result of Graves' disease. Would I be able to stop taking the medication eventually? And also, those on YouTube, what I'll do is I will answer this one and then one more, and then I'll get to YouTube, and then I'll go back and forth. So meaning I'll answer a few on YouTube, but I will go back to Zoom. I know there's a lot of questions on Zoom here. So I'm taking 10 milligrams of methimazole for hypothyroidism as a result of Graves' disease. Would I be able to stop taking the medication eventually? I mean, that's the goal when I work with someone. Oh, wait, hold on a sec. I'm taking 10 milligrams of methimazole, I assume for hyperthyroidism. You typed in hypothyroidism, but Yes, I'm guessing you meant hyper because that's what methimazole is taken for. So yeah, my goal, I mean, not that I tell people, I honestly don't say, you know, stop. I'm not a medical doctor, so I don't tell people to stop the methimazole, but as their numbers improve, my goal is to help them to, you know, find triggers, underlying imbalances, and, you know, by doing that, their thyroid panel numbers will improve, you know, antibodies will improve. But as far as methimazole, we're looking mainly at the thyroid hormone levels, as well as the TSH. TSH is pituitary, but still, like when endocrinologists uh, look to decrease dose of methimazole, if someone has thyroid hormone levels that are looking good, but TSH is still depressed. Depends on the doctor. Sometimes they still might decrease methimazole, but sometimes they won't until TSH starts increasing. But anyway, Joan, yeah, I would say that there is you know, I can't make promises because everybody's different, but all I could say is the key is to try to find triggers, underlying imbalances, you know, yeah, like besides the challenge, visit my website. I talk a lot about that too. But the problem is most people, what they do is they go to the endocrinologist and they just take the methimazole, but they're not doing anything else. And sometimes they go into temporary remission. Sometimes the numbers still improve to the point where they could get off the methimazole. But usually, more times than not, the hyperthyroidism will come back because they never did anything to address the reason why the hyperthyroidism developed in the first place. So, so yes, that's what I would say. And then Jessica says, "Hi, Dr. O. I am Jessica. I am a 40-year-old Hashimoto's. Okay, Hashi's hypo for almost a month. I've been experiencing both hypo and hyper symptoms. So what I would say is next time you get blood drawn, Jessica, is I would do all three thyroid antibodies that I mentioned earlier, thyroid peroxidase or TPO antibodies, anti-thyroid globulin antibodies, and thyroid stimulating immunoglobulins. And if your TSI, if it's positive, then you might have Graves. You might, I mean, people again have, some people do have antibodies for both Graves and Hashimoto's, and some people have Hashitoxicosis. So if your TSI, you know, if they're negative, the antibodies for Graves are negative, and you have one or both of those other antibodies positive, then it probably is Hashitoxicosis. And, you know, either way, whether it's Graves, Hashitoxicosis, you still want to address the, you know, they're both autoimmune, so you still want to do things to address the autoimmune component. But the symptom management, you do want to be careful with Hashitoxicosis. Like if someone has Graves and they're taking, you know, let's say methimazole, you know, anti-thyroid medication. It could be methimazole, it could be PTU, it could be carbimazole. But either way, you know, for Graves, that's a common recommendation. For Hashitoxicosis, the hyperthyroidism very well might be more transient. So taking methimazole might not be a good idea. Taking anti-thyroid medication might not be a good idea. In that case, I mean, maybe bugleweed, even though bugleweed also has anti-thyroid property, that's an herb. Again, I'm not telling you to take bugleweed, just saying like if I'm working with a patient with Hashitoxicosis and we're trying to manage the hyper symptoms, but even with bugleweed, we got to be cautious because they might become hypo, not due to the bugleweed necessarily, but just because it's, you know, transient state. So a lot of times what doctors will do, if doctors know that it's Hashitoxicosis and not Graves, they might just tell the person to take a beta blocker. We see the same with like subacute thyroiditis. Subacute thyroiditis is temporary, so a lot of times medical doctors won't want to give anti-thyroid medication. So instead they will tell the patient to just take a beta blocker. All right, so let's, we will get back to the questions on Zoom, but I'm gonna hit a few questions on YouTube. And we don't have as many questions on YouTube, but let me actually take a quick sip of water here. All right, so Linda asks, is there anything specific you could do to lower your antibodies? So I wouldn't say there's like one thing, like when you say specific, And everybody's different. So, food is important, which is why I'm having a challenge that focuses on it. Because if food is a trigger, then, that doing that one thing, just cleaning up the diet, um, can make a big difference. But it's not a factor with everyone, which is why one of the lessons talks about things other than food. But so most of the challenge is going to be focusing on using food, using diet to heal hyperthyroidism, but there could be other factors which could cause the elevated antibodies. Again, I mentioned the four main categories of triggers: so food, stress, infections, chemicals. Also the gut. Try to avoid immunity. Healthy gut you need, because increased intestinal permeability is a factor. So there are a number different things that are necessary to lower antibodies. And unfortunately, not just one thing. I mean, in some cases, some of you might be familiar with LDN, low dose naltrexone, which is a medication, and that modulates the immune system. And sometimes people could take that, and that will lower antibodies, sometimes even normalize antibodies. The problem with LDN, and again, sometimes I do recommend LDN, but the problem with LDN is, first of all, it's not doing anything for the cause of the problem, so it's not really a fix. But in addition, it's hit or miss. Like whereas methimazole definitely is, like, side effects are more common. That's the problem with methimazole and other types of antithyroid medication. LDN side effects are not nearly as common, but it's not as effective. So if someone takes methimazole, it almost definitely will help to lower thyroid hormone levels. LDN, it's not always going to work. Many times it won't work. So that's why it's not necessarily a real good first choice for someone with hyperthyroidism. All right, so Loretta here. How long did you continue to take buckwheat and motherwort after remission? So I took buckwheat and motherwort. It was, I mean, I took it for about 9 months. And really, I guess at that point, I was, that's when, that's when I thought I was in remission. I guess I was, but even after that, I wanted to see a few other blood tests. But so like, let's say 9 months, I was off not methimazole, the buckwheat and motherwort. And then a couple of months later, I forgot exactly, it's been, like 11 years, but a couple of months later, let's say I did another thyroid panel, but at that time I was off the buckwheat and the motherwort. Big thing, buckwheat is the one that affects thyroid hormone levels, but so I wanted to be off that to see what everything looked like without taking, the herb. So I took it for a total of about 9 months. Everybody's different. I'm not saying everybody takes it for that long, but some people, I mean, again, it's not uncommon. So some people will take it for a longer period of time. It does take time to get into remission. All right. So someone from New York City, at least that's your YouTube name. So my thyroglobulin is 76. Is that bad? It was 450 previously. I mean, I've seen thyroglobulin antibodies in the thousands. So 76 by comparison is not too bad. Sometimes it's hard to, like, what Graves' disease antibodies, it does seem like the higher the antibodies, the more severe. Like when someone has higher TSI levels, they are at greater risk of developing thyroid eye disease. With thyroglobulin and TPO antibodies, higher doesn't necessarily mean worse. And we do see more, it seems like with those antibodies, more fluctuations. But I mean, obviously the lower, still, it's nice to see lower antibodies, and eventually we want to like normalize them. So lower in that respect is better. So 76, definitely better than 450, and definitely better than, having it in the thousands, which, like I mentioned, I have seen. All right, so Jean asks, when will the link be available to sign up for the Hyperthyroid Healing Diet Challenge? Definitely this time next week. I'm, thinking Friday, this coming Friday. So probably like a week and a half before. So it's a little over 2 weeks now. I don't have the I know not everybody here will join Facebook. That's why I have these Zoom calls, because I know not everybody will, not everybody's on Facebook, and more and more people, for good reason, leaving Facebook, with all the censorship and all that going on. But so anyway, that's why also during the challenge, I'll be having both. I will be having a Facebook group, and but I'll also be having the Zoom. But I do want to. So anyway, so probably this Friday, this coming Friday, or next Saturday. So a week, I would say no later than a week from today, and you'll definitely get an email. So hopefully, I mean, everybody on Zoom, everybody should be on my email list. Maybe some people on YouTube might not, because if you're a subscriber, then you might have just gotten an alert. But if you're on the Zoom call, then you definitely got the email. So definitely look out. There'll be multiple emails. I always send out a few emails during the challenge, not to be a nuisance with the emails, but just deliverability is not great. So you know, a lot of people we get so many emails. I know I get like tons of emails. So but once someone registers, I try not to like send them again as far as registration email. All right, so let's see. All right, so Maria, hello. Is there a connection between a multinodular goiter and anemia and Sjogren's syndrome? I developed this post-thyroid issues, and I started being allergic to lactose, gluten, and more stuff. I have to add that my only problem is thyroglobulin around 80 to 90, but no antibodies. All right, and this will be the last question I answer on YouTube, because really this is right now the only, this is the last question, and then I'll go back to Zoom. But even if someone else types in a question in YouTube, I'm going to go back to Zoom after this. Yeah, so I can't say I've seen a connection between, I mean, anemia, I have not seen that connection between multinodular goiter and anemia. And Sjogren's syndrome, no. I mean, that's autoimmune. So, I mean, if someone has Graves, they might have greater susceptibility. And even that, I can't say I've had. I mean, I've seen a lot of other autoimmune conditions. A lot of people, again, with antibodies for Graves and Hashimoto's, rheumatoid arthritis, you know, lupus. Again, I'm not saying I haven't seen people with Sjogren's, but I can't say I've seen a lot, honestly, of people at least diagnosed with Sjogren's syndrome. Which, yeah, I know that's not, I mean, none of these autoimmune conditions are fun, but a good friend of mine, his wife, you know, was diagnosed with Sjogren's, and, you know, a lot of dryness, dryness in the eyes and the mouth. And yeah, so, but like I said, I have not seen that connection when it comes to multinodular goiter. So let us go back to Zoom. And so what I'm going to do with Zoom, I'm going to try my best to, again, I don't know if I'm going to get to all questions. I'm going to go about another 30 minutes. So about 3:15. So that'll be about an hour of Q&A, because I ended around, I think 2:13 is when I ended. So I'll go an hour, and I'm going to try to skip, like if someone asks more than one question, if I remember that they asked a question, I'm going to skip over them just to try to get to as many people as I can at least one time. And then I will, I might do another, I didn't know what kind of, how many people would show, but we have actually a good amount of people on both Zoom and YouTube. So, so maybe I will do another one next weekend. I'm not sure. Definitely will do one the Saturday before the challenge though. So next Saturday, tentatively. I might also do an evening one, I was thinking. Since the Zoom calls, the challenge, they'll have some calls at night. So I might do a evening call within the next couple of weeks too, similar to this. All right, so Cheryl, with Graves' disease, is it possible to get back in balance using bugleweed, eating lots of greens and supplements? I mean, that's what I did. When I dealt with Graves, I didn't take the methimazole. I would have if bugleweed didn't work. I'm not against methimazole. A lot of my patients take antithyroid medication, and I never try to talk them out of taking antithyroid medication. But I took the bugleweed. Again, I took motherwort as well. And I don't know. Now I eat a lot of greens. Back then, I don't know how many. I mean, definitely not as much as, because I never, honestly, I just wasn't a vegetable person growing up. I just never had. I mean, my parents didn't force me to eat my veggies, so I didn't. Um, so I can't say I ate lots of greens, even though I do recommend them to my patients, and that's what I do now. And I did anyway. So yeah, I ate vegetables. I mean, the big thing was whole foods. Like I said, eating whole, healthy foods. Good, yeah, and eating a good amount of vegetables. Like I said, I eat more these days than I did back then. Um, and then, like I said, the bugle wheat, and yeah, and taking supplements as well. Trying not to go crazy with the supplements. I mean, I do like supplements, but I see people, like, I have patients who walk in, or not walk in, but especially now, not with everything. I've been working remotely even before the COVID stuff, but especially 2020. Um, since that everything has happened, I haven't seen anybody face to face. But so I have people that, when working remotely, virtually with people, that they have like lists of like dozens of supplements that they're taking, and it's easy to I fall into the trap too, just because I get exposed to a lot of supplements. But being a healthcare practitioner, I attend a lot of nutritional conferences. Again, now, actually, I've attended one today, 8:30 to 12:30. I had an online nutritional conference, and it was talk about the stress response. So, and they definitely spoke about supplements during the conference. So, all right. So next question. Um, NMC, been on methimazole for 8 years, started bugle wheat combo 7 months ago, but haven't been able to lower my dosage as TSH drops 2 at every attempt. Functional testing indicates antibodies to HHV6. How do you suggest treating this? Have you ever seen this leads to Graves? Yeah, different viruses. I mean, not everything's in the research, but I've seen different types of herpes viruses, of course, Epstein-Barr, cytomegalovirus I've seen, but more commonly what's like subacute thyroiditis. Um, but just keep in mind, viruses, sometimes I will treat viruses, but we all have viruses. And, of course, 2020 was the year of the virus, extending into 2021. But even, whether it's Epstein-Barr, whether it's, HHV6, whether it's, COVID, I mean, we still want to do everything we can to improve immune system health. It doesn't mean that you can't be susceptible to effects of the virus, and that you might, there are times, again, when you might want to still treat the virus. There's you could take a more, as far as like, so let me backtrack. So number one is do things to improve immune system health. Anything that's dragging down your immune system. So, eating an anti-inflammatory diet, doing everything you can to manage stress, trying to get sufficient sleep, reducing your toxic load. All these things, important. The toxic molds. I mean, there could be a lot of factors that drag down the immune system. So that's number one. If you're going to treat the virus, there's different ways of treating viruses. I mean, you could take an herbal approach, taking certain herbs that have antiviral properties, such as well, licorice root is actually really, the St. John's wort, which is known for depression, but also could help. But you got to be careful with St. John's wort. Licorice root also you got to be careful with. That's a lot of times they give for adrenals, but if someone has high blood pressure, quercetin, commonly taken for like histamine problems, but could also help with viruses, and monolaurin as well. Olive leaf is really good, and those are some general antiviral agents, natural antiviral agents. There's also more specific homeopathic formulas. Not sure for HHV6. I know for Epstein-Barr, of course, cytomegalovirus, herpes simplex, I think parvovirus. So for a number of, not for COVID so far, but not that I've seen as far as homeopathy for that. But yeah, so I would focus primarily on improving immune system health, but in some cases I will recommend herbs or homeopathy, and there's other things like ozone therapy, UV light, and I actually did that when I was dealing with Lyme, chronic Lyme disease, but again, that is pricey, and that's also, it's not a permanent fix. There are people that get ozone, UV light, and they feel great. And then a few months later, it comes back because it's typically not getting rid of the virus. It's enhancing the immune system response. And I mean, yeah, so not to say you can't get rid of certain microbes, but viruses are kind of difficult since they're in your cells. All right, so let's see. I'm gonna, again, have a few questions from the same people. So like I said, I'm gonna I might get back to you, but I want to make sure to get to those who haven't had the chance. So let me, all right. So have Graves, but haven't heard of subacute thyroiditis. What's the similarity? So I don't know if you missed the part. I went over it in the, and this is being recorded. So so I will send out a replay. Might be a few days. And also, if on YouTube, Natural Thyroid Doctor is my YouTube channel, and it should be available. I don't know if it'll be available immediately like Facebook, but usually, definitely within 24 hours, but probably a few hours. So, but typically subacute thyroiditis, also hyperthyroidism, but usually virus induced and usually temporary. All right. Is there any natural way to shrink thyroid, not the thyroid and nodules? So yeah, goiter, nodules. I mean, goiter. So thyroid swelling, I actually wrote, I think it was either beginning of this year, maybe it was, I mean, obviously this year is just a few weeks old now. So it might've been last December where I wrote an updated blog post on goiter. Thyroid swelling is what the name, like, ways to decrease thyroid swelling. I think I forgot the exact name, but check that out. But I mean, if you have hyperthyroidism or hypothyroidism, any thyroid hormone imbalance can cause goiter, and but also estrogen, problems with estrogen metabolism. I mentioned insulin resistance also could be a factor. There is an article that or blog post that I wrote, 5 things to know about thyroid nodules. So you could visit again my website, naturalendocrinesolutions.com, and I talk about also shrinking nodules. Okay, Lisa, how do you heal the antibody component? My TSH, T4, and T3 are in range. So I did mention someone had a similar question on YouTube as far as the antibodies. So again, you want to find and remove the triggers, heal the gut, correct underlying imbalances. I know easier said than done, but it is a complex topic as far as lowering antibodies. So again, the triggers, remember I mentioned the 4 different triggers: food, stress, chemical, infections. Obviously that's broad, like when, there's a lot of different chemicals, a lot of different potential infections, different foods, but yeah, just find it. Again, it's a challenge. I mean, and like I said, just everybody, of course, attend the challenge I'm having, A, because it's free, B, because I'm going to go over the food trigger component. And then also I'll be spending some time on some of the other components, as well. It's going to be mostly food just because that's the name of the challenge, but I'll touch upon some of these other things as well. All right, let's see. This is a private message. I have Graves' disease. I'm taking 5 milligrams methimazole for the first 2 years, and from 2019 until now, I take 2.5 milligrams a day, and my TSH is 1.8. When will I stop taking methimazole? So again, I can't tell you to stop, or I can't predict when you will stop, but 2.5 milligrams is a low dose. I mean, that's pretty much half a tablet. And 1.8 that's pretty good. So, I mean, it sounds like your endocrinologist might be a little bit cautious. I mean, which I could understand. But if your thyroid hormone level, especially if you're free T3, free T4, if they're on the lower side, they might be within the lab range. But if they're on the lower side, then TSH is 1.8. A lot of endocrinologists will either tell the person to stop the methimazole, or if they want to be super conservative, they might say take it every other day, like the 2.5 milligrams every other day. Or I've seen them say take it like 2 or 3 days per week, like Monday, Wednesday, Friday, for example. But it looks like you're pretty close. As I mentioned earlier, just hopefully you've also done things to address, find, remove triggers, address underlying imbalances, because that's, unfortunately, again, a lot of people who just take the medication end up relapsing. Okay, so Averill, I hope I'm pronouncing your name correctly. So what is the first thing you would suggest for multinodular goiter once ongoing herb medicines have put results in normal range? So it sounds like maybe you took bugleweed, let's say, and maybe you had toxic multinodular goiter, took bugleweed, and now thyroid hormone level is normal, but what would you do next? So again, I would always say basics. So hopefully you're eating a clean diet, even though it's not Graves and we're not dealing with autoimmune component. You still want to eat anti-inflammatory diet. So all the basics: diet, stress management, important. Getting working on proper sleep is important, and But again, I would be looking into. So estrogen metabolism and blood sugar are like the first thing. So blood sugar, a lot of times you can address that through diet, but if there's other factors like inflammation, I keep on mentioning inflammation, and then not insulin resistance, estrogen metabolism. So the only test I know of that looks at that is the Dutch test, the dried urine testing, that looks at estrogen metabolism. And again, it's not something I have everybody do. Certain foods support estrogen metabolism also, such as broccoli, cruciferous vegetables in general, and broccoli sprouts are really good. And you need also, when it comes to sex hormones, estrogen, of course, is a sex hormone. You also need healthy adrenals to have healthy sex hormones. So just also making sure that your adrenals are in good health. And like I said, I do like testing for adrenals. Not all practitioners. Most endocrinologists, of course, do not look at adrenals unless if they suspect something serious, such as Addison's disease or Cushing syndrome. All right, so Marta here says, after 2 years of trying to reduce the triggers and trying to heal the leaky gut, my TSI antibodies went from 4 to 1.68. My TSH raised from 0.01 to 0.04. Yeah, so obviously, TSH not really budging much, but TSI decreasing. Obviously, 2 years, you'd want it to get normal. So I guess the question, which again we probably won't be able to address here, but so what did you do like to reduce triggers and heal the gut? Did you, like some people, when they try to heal the gut, they'll drink bone broth, and like that's their, that's what they talk about healing the gut, which could help, but again, you want to remove any factor that's causing a leaky gut. And then again, like triggers, like what did you do? Again, because there could be a number of different triggers. So some people might just reduce gluten, so maybe like cut out gluten, drink bone broth, and for some people that might be enough. But for a lot of people that wouldn't be enough. And I'm not saying that's what you did. Obviously, I have no idea specifically what you did, but I guess I just would be curious, like something's missing. It's obvious that you still have some type of trigger potentially, or maybe the gut potentially is still not healed. Maybe you're not, maybe you're eating certain foods that are, and again, this might not be the case, but yeah, so definitely, again, join the challenge, which I'm going to, of course, recommend everyone to join the challenge. But since it's my challenge and I'll be biased, but again, you also, I'll have a few more of these calls, but then I'll be giving, and then during the challenge, so what I'm going to be doing during the challenge as far as support goes. So Monday through Friday, Monday, Tuesday, Wednesday, and Friday, I'll be having live calls, Zoom to Facebook, that focus on a topic, and then I'll do Q&A. And then that Thursday, I'm going to have 2 calls, like kind of like what we're doing now, except it's really just going to be Q&A, actually. Every day is going to be kind of like we're doing now, but the one Thursday call is just going to be Q&A. There's going to be 2 times, one during the day and one in the evening. So there's going to be a lot of time for questions and maybe to go a little bit deeper. All right, so Arsinia, again, I apologize if I didn't spell your name or pronounce your name correctly. So how do you cure thyroiditis? So it depends on what's causing the thyroiditis. So thyroiditis is, I mean, that's inflammation of the thyroid gland. So you could have thyroiditis. I mentioned subacute thyroiditis, which is viral, and that, you know, so you want to do things to improve immune system health. Graves, you could have, you know, with Graves, inflammation of the thyroid gland as well, and Graves is autoimmune. So focusing on finding, removing triggers, healing the gut. And so yeah, that's the quick answer. All right, and I'm just gonna. This was someone who mentioned the question earlier, but I did ask her to kind of just elaborate. So with the autonomic, with regards to autonomic dysfunction, I think my trigger is stress, absolutely. But is it that ANS is then imbalanced, which affects the vagus nerve too, and everything surrounded the PNS, SNS, which is parasympathetic, sympathetic nervous system, which comes first? Thyroid affects ANS, or ANS affects thyroid. Typically, it's the latter. Usually, I mean, again, thyroid definitely will affect ANS, but typically, it's the autonomic nervous system stress response, problems with, you know, parasympathetic nervous system imbalance affecting thyroid. So, all right, and then and Jessica, this is uh, like 40 minutes ago when I asked late where everybody is from, or yeah, I said I should have asked where everybody is from, and then someone said Jessica is from St. Augustine, Florida, which I like St. Augustine, so we go to Florida a lot, and we have a friend in Ormond Beach, which I'm sure you're familiar with, in the Daytona area. So we're always passing by St. Augustine, and yeah, very very nice town. So. All right, and then we have Heather with Graves in Vermont. Um, okay, asked about muscle pain at night. I must have missed that. Forgot to tell you that about my CK blood work was in the thousands one week, then 109 the following week. What's up with that? So I'm not sure what that, but let me see what I must have missed your. Okay, this is it here. So I have Graves, diagnosed in September 2020. Lately, I've been waking up in the middle of the night with terrible, terrible muscle pain, mostly my hips and thighs. Any connection? Um, I mean, not typical of Graves. I'm not saying there can't be. I mean, everybody's different. Like when I was dealing with Lyme, my symptoms weren't classic Lyme symptoms. When I went to a regular medical doctor, he didn't even want to test me for Lyme, and he actually didn't test me for Lyme. He wanted to refer me to a neurologist, and just based on my experience with people working with some people with Lyme, I kind of had a good feeling it was Lyme, so I didn't listen to him. But reason I'm bringing that up is because that's what you mentioned isn't classic with Graves, but not everybody has classic symptoms. But I mean, so I definitely would make sure you look into nutrient deficiencies, you know, like magnesium, potassium. But I also, again, just, you know, I try not to be biased with my experience, but sometimes stealth infections like Lyme, Epstein-Barr, like if someone wakes, I know what Lyme, I had that for a little bit where, you know, I would just wake up like really bad, like Charlie horse, or, you know, and not just Charlie horse, but other like shock sensations, or, you know, so maybe not exactly what you're experiencing, but, you know, again, Lyme, Bartonella, you know, different co-infections. I mean, you know, viruses, maybe. Again, I'm not saying that's definitely what it is, but, you know, like I definitely would make sure that you're eating, you know, the basic, following the basics, eating anti-inflammatory diet, you know, managing stress. And again, maybe, you know, like, you know, magnesium, potassium deficiencies can potentially be a factor. But if things like that, those symptoms persist, you might need to dig deeper. So, All right, so all right, so thanks so much for that. I remember now you had it in the class. Great, on my way there. Jessica, could you please repeat the R list? So the 5R protocol, the first R is remove, second R is, so first R remove, second R is replace, third R is reinoculate, fourth R is repair, and fifth R is rebalance. And this is also on my website too. I've spoken about 5R protocol on my website. And also this is going to be recorded. So, all right, so a different Kate from North Carolina. Can you speak to the link between autoimmune dysfunction and interstitial cystitis? Could my thyroid disorder be the cause, and therefore could it go into remission with proper thyroid care? So we have, very rarely do we have like people ask about autonomic oh, actually, it's not autonomic. Okay. I thought it was autoimmune dysfunction. I thought it was autonomic dysfunction. I was like, wow, we have two questions on autonomic. So the link between autoimmune dysfunction, interstitial cystitis, and I've had a few people with interstitial cystitis. I can't say I've had a lot of people with the condition, but enough where maybe I might in the future write up blog posts. But could my thyroid disorder be the cause? And therefore could it go into remission with the proper care? So if your thyroid, like, I don't know if you have Graves disease, but it is a possibility that there could be a link. I mean, of course, either way, you want to remove triggers, correct underlying imbalances, but it is possible by doing that. It can address kind of kill two birds with one stone, as they say, help with the if let's say it's Graves, and then also help with the interstitial cystitis. Okay, so it's Ahisha asks, what is the link between Graves and type 1 diabetes? I mean, not really a big link that I've seen, other than they're both autoimmune conditions, but I can't say, even though autoimmunity is more like someone with one autoimmune condition is more likely to develop multiple autoimmune conditions, but I can't say I've seen a lot of people with type 1 diabetes in my practice. I've seen a lot of people with insulin resistance, type 2 diabetes, but yeah, but they're both immune system conditions. Type 1 diabetes, as far as I know, there's really no way to like get into full remission. Like if someone has type 1 diabetes and they're taking insulin, like it's not like Graves. Like with Graves, pretty much the goal is to get, when someone's in remission, where they don't need to take methimazole, where they don't need to take antithyroid medication. And I'm very successful with that. Type 1 diabetes, now, again, that's not something maybe there is someone out there that accomplishes that, but I'm skeptical just because the pancreas is not really quick to regenerate. With Graves, keep in mind, Graves, it's not really damaging the thyroid gland like it is with Hashimoto's. So that's why someone could have Graves for like 8 years, 10 years, be on antithyroid medication, and they could still, eventually get off the meds. Hashimoto's, that could happen too if they're taking thyroid hormone replacement. It's just more challenging because, again, the thyroid gland, that does regenerate, just does take time. It doesn't regenerate as quick as other areas such as the gut and the liver. So Mary asks, what is your opinion on the role of oxalates in food as triggering Graves? I don't know. I've written a few articles on oxalates and actually tested high for oxalates. I did a urinary test for oxalates, and I'm pretty sure it was because at one time I was stuffing my smoothies with spinach, which is very high in oxalates. So now I still have smoothies, but I typically don't add spinach. But I really don't know about it being a trigger of Graves or even being a trigger of autoimmunity. So again, check out my articles. I've written a couple of them. I think, again, I think I've written 2 articles on oxalates. But yeah, I mean, so you want to decrease them, try to do as much you can through food, because that's usually what's causing them. But there could be other factors like yeast overgrowth. fungi, so not just yeast, but mold. Those could be factors with oxalates too. So food, and I would say yeast, mold. All right, did I answer a question from this person? I don't think so. Let me just, yeah, so again, I don't know if I pronounced your name correctly, but I was diagnosed with Graves at the end of July 2020, and my diagnosis was confirmed by TSI and TSH receptor antibody tests. I recently learned that TSH receptor antibodies divide into the stimulating and the blocking antibodies. As TSI stimulates the thyroid hormone receptor, I'm just wondering whether TSI is the same as TSAB. So yes, pretty much, yeah. I read that Graves patients can oscillate between TSAB and so that's stimulating and blocking. So it's important to monitor the two if remission is the goal. I wouldn't say they I guess not really oscillate. I mean, it's possible, just like someone could have TPO antibodies, thyroglobulin antibodies and TSI, and it's not really oscillating. Like, it's not like, you'll do the testing and one, in January, someone will have TSI, but the other two will be negative. And then in March, TSI will be negative and TPO will be positive. So it's not really, and you might have not meant that, but yeah, if someone does have other antibodies, yeah, of course ideally you want all the antibodies to be normal. All right, let's see. We got Stephanie. So Stephanie, which you're on camera too, on video. Thank you for being on video. Hello, hello. A few people. I see Marta on video too. Those who are on video, thank you. Those who are not, I understand. A lot of times I do Zooming without video too. So, and if there's anybody else I missed who's on video, yeah, just I'm only seeing a few people right now, just like 3. So Stephanie's question, what is the typical recovery time for Graves patient who is following all these recommendations? So I would say, again, in my case, and I'll give my example and then I'll kind of generalize a little bit. So my example, 9 months I was off the bugui, the motherwort. But again, I wouldn't say I was stable then. I wanted to do another blood test just to make sure that thyroid panel look good, that antibodies look good. So I would say in my case, let's say like 11 months maybe, just, on average, I would say, between 9 and 15 months would be like a range, if I had to get, so, it's, yeah, like I like to, like a year is a good, but, of course a year is just a number, it's general. Some people, yeah. So I'd say like the 9-15 month mark. Obviously there are exceptions to really anything there could be, but that's what I like to see. And thanks for your question. All right, and Linda, I think I'm okay. 3:13. I'll go a few more questions here, and then I'll call it a day. So Linda, does LDN help with Graves? Does skull cap help Graves? So I mentioned the LDN earlier. So LDN is kind of hit or miss. Sometimes I do recommend if someone is unable to tolerate antithyroid medication, so side effects are common with, methimazole, PTU. So if someone can't take the antithyroid medication, and let's say if bugoid is just, I mean, bugoid's great, but it's not effective in everyone. I mean, LDN is not either, but then we kind of go down the list. LDN is, so we might look into LDN. Skull cap, I can't say, I mean, I'm familiar with the herb skull cap. I can't say I've given it to Graves patients. There's a lot of supplements out there, a lot of herbs. I can't say I haven't seen anything in the literature. I haven't heard from other practitioners, even though there's not a lot of practitioners I know of that help work with people with Graves, but I don't know. So the honest answer is I'm not sure, just because from an experience standpoint, I haven't really used it in my practice. All right, so we have Ethan here. So hi, Dr. Eric. I have hyperthyroidism. I took recent Genova and Dutch tests. Results show that my sex hormones are very low, including estradiol, progesterone, testosterone. Cortisol is high. So remember, cortisol, there's something called cortisol steal, where, if you have like a lot of stress, it's going to steal away from the sex hormone. So definitely adrenals are important in this case. I've been following the AIP diet for 3 months now. My DO, which is a doctor of osteopathic medicine, DO is recommending addressing the adrenals and estrogen, progesterone, TSH 0.01, thyroid peroxidase 170, which is elevated, thyroxine 12.8, which I think is slightly high. It depends on the range. Every lab's different. Definitely on the higher side, assuming you're in the United States. If you're outside of the US, that might not be, that would be on the lower side, but I'm guessing you're in the US. Reverse T3 35, which is high, and that's pretty common with hyperthyroidism for RT3. So again, so diet-wise, you're doing great with AIP. But I mean, stress, I mean, definitely high cortisol, low sex hormones. Not to say stress is the only problem, but and you said your DO is recommending addressing adrenals and estrogen, progesterone. But I mean, I don't know what specifically your DO is saying to do for estrogen, progesterone, but I would first focus on like in my practice, I focus on adrenals. Like I'm not against bioidentical hormones, but if you have healthy adrenals, a lot of times that will increase the sex hormones naturally without taking bioidentical hormones. So that's usually what I would recommend. If someone has healthy adrenals and their sex hormones are still low, then maybe they do need to take some bioidentical estrogen, progesterone. But I definitely agree with focusing on adrenal health, which could have a huge impact. Now, high cortisol also suppresses immune system. So there could be other factors like, infections like viruses, but you still want to get the adrenals in order, because if you were to, let's just say, focus, let's say if Epstein-Barr is a factor and you treat Epstein-Barr, but you don't do anything for adrenals, you probably won't recover. So whereas if you treated adrenals, you might not need to address Epstein-Barr. Again, it depends on the person. But hope that helps. All right, so I'm going to go a little bit longer. I know it's past 3:15, but let's see. Is it safe for me to take methimazole for long term? I am 28 years old now, 10 to 14 years. Is it safe? 10 to 40 years to take methimazole. I mean, that's not ideal. So I mean, the goal is not to take methim. I mean, I know there are some people on here that I think the longest I saw was 10. I mean, and I've seen people take it longer than that. I mean, let's put it this way: if I was given a choice to get radioactive iodine, thyroid surgery, or to take, let's say, a low dose methimazole forever, and if there were no side effects, forever, the rest of my life, if there were no side effects in my case, I probably would choose that. I mean, again, that's not ideal, trying to get to the cause of the problem, but I would do everything I can to avoid radioactive iodine thyroid surgery. That's my opinion. I mean, everybody's different. So, so as long as liver enzymes look good, white blood cell, because methimazole can depress white blood cell count, could elevate liver enzymes, and it can cause other side effects. So if I was tolerating it well, I guess I'd be okay taking it long term. But if you haven't done things to address the cause of the problem, find, remove triggers, even again, just starting with the basics, diet, lifestyle. So again, 28, regardless of how old you are, but especially someone, who's, like in their 20s, yeah, I would hope that you wouldn't, need to take methimazole for like, 40 years, let alone like 5-10 years, even though, again, some people do. And if you're on the call and you take it for that long, that's fine. Just make it a goal. Just like I said, continue, to continue to, hopefully you're attending this call, so you're trying to be proactive, and hopefully you also have read my book, even though it's time for a new book. That book is still a lot of the information is relevant, but I need a newer book that revised in 2013. So a new book eventually will be coming. I don't know, probably not this year, but maybe 2022. All right, any specific recommendations for Graves and fertility? I would visit my website. I do have an article, that talks about fertility. I mean, Graves definitely, I mean, thyroid hormone imbalance is in general, but especially I do see with Graves, a lot of times the woman, their cycles become irregular. Sometimes it will stop. So definitely getting the thyroid hormones in balance, and then, there's also increased risk of miscarriage with elevated thyroid stimulating immunoglobulin. So you definitely want to address that autoimmune component. But and then again, obviously lifestyle components like the diet, stress management is important. But, and then trying to do everything you can to reduce your toxic load, now, because once you get pregnant in the future, you won't be able to do that. But of course, now it sounds like you're focusing just on, getting pregnant, on conceiving, but definitely check out my website and do a search for fertility, and you'll find some information on that. Okay, so James also had muscle and joint pain in my hips too. I was diagnosed in October 2020. My doctor thought it was a side effect of the drug I was on, so they switched me to another one. And since then, I haven't had the crazy pain in the hips. Yeah, that's a good point. That is a very good point, James. I've been talking about some of the side effects of methimazole, and a lot of people do tolerate it well. But if you're having any type of pain, or I mean, some people have a patient right now who's dealing with a lot of itchiness, which I mean, I'm sure there's others I might be dealing with who has some itchiness, but one that I just communicated with, yesterday, who's, anyway, and she's not on a real high dose of methimazole. But yeah, that's a real good point. I'm glad you brought that up, because yeah, if that person before, and you might not, the person who mentioned that before, you might not be on antithyroid meds, but if you are, it's worth bringing it up to your medical doctor. And methimazole is most commonly given, or if you're overseas, carbimazole is another one which converts to methimazole. PTU not as commonly given. It's puts more stress on the liver typically, but if you're first trimester or pregnancy, PTU is usually given, and then switch to methimazole. But otherwise, usually methimazole, carbimazole. But some people do fine with PTU. I mean, it's not just, and again, there are some studies that look scary as far as the effects it can have on the liver, but I've had a number of people on PTU over the years, and yeah, some of them did have elevated liver enzymes, but many of them did fine. So if someone's having side effects, if you're on methimazole, and if someone's having side effects, feel free to speak with your doctor about switching to a different type of antithyroid medication. All right, so I knew this question would come up. I was waiting for this question, so not really. I wasn't really waiting for it, but it's come up during some past calls. So I have autoimmune disease, and is it safe for me to take COVID-19 shot? So the honest answer is I don't know. I mean, the honest answer is there is no, there. It's a new shot, so I mean, it's a new vaccine, so I do not know. I will say that I am, I do have my goal is not right now. I'll say right now, and probably not in the future. I don't plan on getting the COVID vaccine myself, but I know a lot of people plan on getting it. A lot of people don't plan on getting it too, but a number of people on the, so it's a tough decision. I mean, I try to I try to be open-minded. Like I had someone, a few weeks ago asked me about shingles vaccine. And I'm never going to tell someone don't take this, don't take that. It's really up to the person. Everything's risk versus benefits. And shingles, out of the different vaccines, now again, I had shingles in 2016, and I just turned 50 last year, so I'm eligible. I mean, even then maybe I was eligible, but once you turn 50, that's when they really push shingles vaccine. And I don't plan on getting shingles vaccine either, but I could understand the concern, because shingles, in my case, it didn't affect the eyes, but it can cause blindness. In my situation, did affect the hearing a little bit. But with COVID, it's a completely new vaccine. So so again, even with like my parents plan on getting, I know they're going to get, they're definitely medically oriented, and they have a history of not listening to me, which is common with parents of healthcare practitioners. But anyway, so I know they're going to get it, and and yeah, anyway, so my younger sister just, from what I heard, she just actually, she chose to get it. I think my oldest sister probably is not going to get it from what I heard, or at least, I mean, the truth is they might, yeah, anyway, so this is going, I was going to say they might eventually make it to the point where we very difficult not to get it, like if they make it kind of mandatory, not where they'll force it to us, but that's not your question anyway. So that's getting into more controversy. And as far as, is it safe to take with autoimmunity, like if you have Graves' disease, I don't know. You know, that's again, there's a lot of unknowns with that. And so I can't say not to take it. You know, even my patients, I can't say don't take it. What I am like, if I was thinking about it, I probably would still like delay it, just because I'd want to see other people how they respond to it. And it's too soon. Like if someone, I mean, there's also some concern. Again, it's hard to know what's, like I said, I try to keep an open mind. I do have more of a bias towards, against the vaccines, just because in chiropractic school, they are, I don't like to use the word anti-vaccine, but again, I grew up, getting vaccines, so, and, again, so I try, like I said, I try to look at both sides of the story. But there was someone that spoke about it potentially could affect fertility. Now, how they know that, I don't know, because again, it is new even to know like that. But I guess that's, I have two daughters, one that's 16, one that's 14. And again, I definitely don't want, and let alone, patients and even people I don't know, it's for it to affect fertility, to have other side effects. So anyway, just like I said, it's yeah, definitely controversial. But yeah, there's, at this point, the answer is I don't think anybody really knows for sure. All right. Someone else asked about hyperthyroidism and leg pain, like muscle pain, like, is there a link? And again, like I said, it's not common as far as, well, actually it's common enough where a few people have brought it up here, but not, I can't say that like 80-90% of people have that, muscle pain, joint pain. But some people do nutrient deficiencies. Magnesium is actually very common, like magnesium deficiency, very common with hyperthyroidism. And again, I mentioned potassium, but again, the methimazole, like anti-thyroid medication, reaction to that if you're taking that. And then, I mentioned stealth infections as well. All right. Kim asks, once ablated, can thyroid come back to function? It depends how much radioactive iodine. It depends on the dosage. I've had patients where their thyroid does restore, like we do restore the thyroid, but honestly, I try not to set high expectations. If someone works with me and they have radioactive iodine, my goals, I mean, not to say that's not a goal, but really the main goal is to try to improve immune system health. If someone had Graves, got radioactive iodine, and then they see me, again, really just try to still remove triggers, to really try to prevent other autoimmune conditions from developing in the future. Sometimes thyroid function can return, but again, many times it doesn't, especially if they use a real high dose of radioactive iodine. All right, so this is a private message. I've been managing hyperthyroidism for over 10 years with carbimazole on and off, but right now my consultant advised me to go for an iodine swallow. I do not want to. Please, what is your advice? So I haven't heard of that referred to that. I assume that's a radioactive iodine, like the uptake test, I assume, and just maybe a different name that I'm not familiar with. But the uptake test, I'm not a big, I mean, it's a small dose of radioactive iodine, so it's not the same as receiving treatment. So that's what I was saying. If someone, sorry, I'm like blanking out here. So I'm getting brain dead here. It's been like an hour and a half here. So but if someone has received radioactive, the uptake test, I mean, if you got the uptake test, again, I wouldn't stress out about it. You'll probably be fine. It's just, the point is, it is radioactive iodine. And if someone hasn't had it, in most cases, it's not necessary, in my opinion. I do have some articles on that on my website too. So definitely check out the articles. All right. So how do you take bugleweed and motherwort, as an infusion or as an oil? So usually as an herbal extract. So usually it's liquid. I mean, I've seen it once or twice, like I forgot the name of the companies, but as a, yeah, so that looks like it might be Herb Farm, like liquid. So Marta is holding up a picture. Um, and yeah, so that's how I took it. I took it as a liquid, and everybody's different as far as dosing. I took like a teaspoon twice per day, and mine was a 1 to 2 extract. Herb Farm, if that's Herb Farm, which I think it looks like an Herb Farm bottle, that's usually like 1 to 5, so it's not as potent. But then it's also based on the person's presentation, like their thyroid hormone levels. All right, so. All right, I'm going to read this, even though it's not really a question, but maybe for a little bit of motivation here. Luke from Canada just comments, I answered a question earlier, but says, I know 10 years is long to be on methimazole, but I'm not ready to give into thyroidectomy yet, which again, I commend you for that. I know and he also says it's hard to keep positive sometimes, but I appreciate your dedication to the topic of natural healing. Yeah, I can imagine being on it for 10 years. I can't relate to that, but I have had patients who have been on it for that long, and so again, there is hope, is what I'll say. All right, let's see how many. So let's see. I think 1, 2, 3. So there's three people on Zoom. I don't think I've answered questions, and then I think there's one on YouTube. So I'm going to answer these 4 questions, and I'm going to call it a day because it's 3:30 here. So Mihai, again, I'm sure I'm not pronouncing that right, but is something Hyalin 951 fermented soy beverage allowed for Hashimoto's or natto? Is ashwagandha and thyro-M by Ayusha Herbs a good treatment for Hashimoto's? So, I mean, I usually don't recommend soy for, both Hashimoto's and Graves. I mean, fermented soy, I will say, I mean, definitely has some health benefits, and I'm not saying to avoid soy forever. I do have a few articles on my website that talk about soy. I don't know what thyro-M is. There's so many different supplements out there. Ashwagandha, now it is part of the nightshade family, but a lot of people do fine with ashwagandha. So if someone's like following strict AIP, then maybe it's best not to take it because it is part of the nightshade family. But I do like ashwagandha a lot. Oh, actually, this next one is not a question. It's actually Monica, not Ethan. I was logged in under my son's name. Oh, no worry. No worries, Monica. I'm glad I answered your question. All right. And then Electra, do you think it's safe to come off carbimazole if following an AIP diet and if getting regular blood test? Again, I can't really advise anyone to do that. I mean, if so you want to be safe while managing symptoms. Well, I mean, you want to be safe while addressing the cause of the problem, is what I'll say. So, I understand not wanting to be on meds. And again, maybe bugleweed is an option. So I'm not saying, someone has to stay on it. I just can't say, is it okay? Is it safe? Because some people do need to take it, and some people, the bugleweed isn't effective. I'd say it's effective in about 70-75% of people, but that's 25-30% of people it's not effective. And so yeah, so anyway, it's, yeah, I would be cautious about just stopping, but I do have some people that make the transition to bugleweed. All right, and this is going to be the last question. I'm going to go back to YouTube here. I'm not sure what your first this is Bobby. So did you say Thomasin will lower antibodies? I'm not sure what you're mentioning. So, but a few different things, like as far as lowering antibodies, I mentioned, just again, remove triggers, correct underlying imbalances, but again, starting basics like the diet. Again, I'll plug my upcoming challenge again to attend my challenge for diet, lifestyle. And then again, I'll be talking about some other things, but that'll be the main focus. And then my TSI is 457. Is that too high? No, I mean, it definitely is high. TSI 457 is very high. And again, I kind of mentioned, just how to lower it. Again, not specifically, because everybody's different when it comes to lowering antibodies. Everybody has different triggers, different underlying imbalances. But that's why I say also start with the basics, because with everybody needs to be eating anti-inflammatory diet and, trying to do their best to manage stress and trying to get sufficient sleep. I know all those are works in progress, but all right, well, let me stop the share. So, all right, well, we made it. We made it through the over an hour and a half here. Let's see. So yeah, we only have a few people on video, but yeah, we had a good crowd show up here. So thank you for attending. I appreciate it. And like I said, I might have one next week. I'm not sure. Definitely plan on having one 2 weeks from Saturday, and I might have an evening one too. So if you're in the United States and you're able to attend that, even if you're outside the United States, but if in Europe, for example, it's probably going to be middle of the night for you. But yeah, and if you're watching the recording from Australia, because it's probably, well, actually Australia, some places you might be early in the morning. But anyway, so I'm going to definitely have one more during the day, probably 2 weeks from today, maybe one next week. I will also say for those who are on Facebook, I have been doing Facebook Lives on Friday. So I will be having a Facebook Live this Friday, probably like around the same time, probably like 2 o'clock. So feel free to hop on Facebook, yeah. So, but again, thank you everyone for attending. Thanks for your questions. Hope everyone has a wonderful rest of your day and a wonderful weekend. And again, hope to catch you in the upcoming challenge. And if not, hopefully I'll catch you on a future Zoom call. But again, thanks everyone. Take care. Have a great day, great weekend.